DripDrop is a fantastic what's called oral rehydration solution. It's sugar electrolytes that get mixed in with water that basically maximizes the absorption of water, especially in a dehydrated child with diarrhea. It's kind of like, well, Gatorade is formulated for athletes. This is formulated for sick people, especially children. So what it does is it's extremely effective at preventing harm, and we can bring children back to life who are critically ill. We really can. And so where we'll be getting it is one of the members of our team is a founder, and he developed it at the Mayo Clinic while he was a resident there, and it was by his invitation that I'm able to go. As of this morning, when I got the go-ahead that I was definitely going about 2 hours ago, there's 3 physicians, myself, Eduardo Dolhun, who is a preventive care physician and family practitioner at Stanford, and I understand a surgeon from Los Angeles. I'm also told that there is a nurse that's a friend of Dr. Dolhun's who'll be going there. One person can make a difference. 95% of the donations that we receive are going to be turned directly into someone who needs something when we get there. As far as we're concerned, it's the only way that works. And it wouldn't work in mass. It can work because we're 3 or 4 people who can get this much stuff, and then we can connect with 3 or 4 people and 3 or 4 people. And between us, we can get a functional network. Funding's always great. There are a lot of people who want to know how they can help. That's always a way we can help, because doctors on the ground may know what they need on a day-to-day basis, and being able to pay the import tariff and being able to get the refrigerated truck instead of the regular truck takes cash, and especially in a place that was pretty remote to begin with, that can be really hard. Right now, before I physically go, one of the things that I'm looking for besides donations is medicines. Volume matters, and the kind of medicine matters. So what I'm really looking for is tetanus immune globulin, other forms of oral rehydration solution, ketamine. I remember when we went to Haiti, I had more Vicodin than I knew what to do with. I couldn't use any of it. It's not a really effective medication for the field, but there are others that are that. And when it comes to the specifics, that's a list I can put together, but those are the kinds of things we're looking for. Actual medicines that are small, that can be contained within the shipping requirements for the airlines we're taking, and that can be carried on the backs if necessary by doctors going directly into the places where it's needed.